Hey guys, and welcome to How to Gastro. So in today's video, we'll be discussing what is a calcium blood test. So let's get started. So before we get into the specifics of the calcium blood test itself, let's talk a little bit about what you can expect when your doctor orders this blood test for you. So a calcium blood test is a simple test that can be done at your closest laboratory or hospital. No special preparation is needed for a calcium blood test, which means you don't have to fast, so you can eat and drink as usual before the test. During the test, a blood sample will be collected from you, which means a needle will be inserted into a vein, usually in your arm, to draw out some blood into a gold top or SST blood tube. So it's important to note that the blood measurement of the total calcium should ideally be drawn from a vein in which the blood is free flowing, which means the sample must be collected without a tourniquet, because the venous stasis can result in falsely raised calcium levels. When the sample is collected, the blood tube is sent off to the laboratory, where it is analyzed and resulted. So what is calcium? So calcium in the blood, also known as serum calcium, refers to the amount of calcium circulating in the bloodstream. So calcium is a crucial mineral in the body, playing vital roles in bone health, muscle function, nerve transmission, and blood clotting. So there are two main forms of calcium in the blood, the free form and the bound form. So the free form or ionized calcium is the biologically active form responsible for most of the calcium-related functions in the body. We then have the bound form, and this form is attached to proteins like albumin or other compounds, and it is inactive until it's released into the blood as ionized calcium. So the body tightly regulates blood calcium levels through hormones such as the parathyroid hormone or PTH, through vitamin D, and through calcitonin, ensuring that the calcium levels stay within the normal range in the body. So if calcium levels are too high, it is a process known as hypercalcemia, or too low, which is a process known as hypocalcemia. It can lead to various health issues such as muscle spasms, bone weakness, or heart rhythm problems, which are known as arrhythmias. So now that we know what calcium is, let's take a closer look at why calcium is so important in the body. So what are the functions of calcium? So number one, calcium is important for bone and teeth health. So calcium is a major component of bones and teeth, providing structural strength. And about 99% of the body's calcium is stored in the bones and the teeth, where it helps to maintain their density and strength. Number two is muscle contraction. So calcium plays a critical role in muscle function. It facilitates the interaction between actin and myosin, which are the proteins responsible for muscle contraction in the body. So when nerve impulses signal muscles to contract, calcium ions are released, triggering the contraction process. So calcium is also important for nerve transmission. So calcium is vital for transmitting signals between nerve cells, which are known as neurons. It helps in the release of neurotransmitters, which are the chemicals that carry messages across the synapses between the nerve cells in the body. Coming in at number 4, calcium is also important for blood clotting. So calcium is a key component in the blood clotting process, which is known as coagulation, and it helps to activate proteins that enable the blood to form clots, preventing excessive bleeding from any injuries that occur. At number 5, we have the regulation of hormones and enzymes. So calcium helps to regulate the release of certain hormones and enzymes, which are crucial for various physiological processes, including digestion and metabolism. At number 6, we have maintaining normal heart function. So calcium is important for heart function as it helps to regulate the heart's electrical activity. Proper calcium levels ensure that the heart contracts and relaxes in a coordinated manner, maintaining a regular heartbeat and thereby preventing arrhythmias. And finally, at number 7, we have cell signaling. So calcium ions serve as messengers in many cellular signaling pathways. They help regulate various functions like cell growth, differentiation, and gene expression by acting as secondary messengers inside of cells. So now that we've explored the various roles of calcium in the body, let's take a closer look at what the calcium blood test is all about. So what is a calcium blood test? So a calcium blood test measures the amount of calcium in your blood. It is a routine blood test that is used to evaluate calcium levels, which are important for bone health, nerve function, muscle contraction, and other bodily processes. So this test helps to assess whether your calcium levels are within a normal range and can help to diagnose conditions related to abnormal calcium metabolism. So what are the normal ranges of calcium in the body? So the normal range for calcium in the blood is typically between 8.5 to 10.2 milligrams per deciliter. So again, that normal range is 8.5 to 10.2 milligrams per deciliter. In cases of abnormally low calcium, which is a process known as hypocalcemia, here the calcium levels will fall below 8.5 milligrams per deciliter. And in cases of high calcium levels in the body, which is a process known as hypercalcemia, the calcium levels here would have fallen above 10.2 milligrams per deciliter. So let's explore these abnormal ranges a little further and see what are the particular causes for them. So first we'll explore abnormally low calcium ranges. So abnormally low calcium levels in the blood is known as hypocalcemia and occurs when the calcium levels fall below 8.5 milligrams per deciliter. So there are 8 main causes of hypocalcemia in the body, and they include number 1, hypoparathyroidism. So insufficient production of the parathyroid hormone, which regulates calcium levels, will also cause hypocalcemia developing. At number 2, we have a vitamin D deficiency. So vitamin D is essential for calcium absorption, and its deficiency can also lead to low levels of calcium in the blood. At number 3, we have kidney disease. So the kidneys help to regulate calcium, and impaired kidney function can lead to hypocalcemia developing. At number 4, we have a magnesium deficiency. So low magnesium levels can affect calcium regulation, leading to lower than normal levels. At number 5, we have a disease called pancreatitis. So the inflammatory process of the pancreas can cause a drop in calcium levels as well. At number 6, we have the use of certain medications. So the drugs like the bisphosphonates, anticonvulsants, and some chemotherapy agents can reduce the blood calcium levels as well. At number 7, we have inadequate calcium intake. So poor dietary calcium intake over time can lead to deficiencies developing in the blood. And finally, at number 8, we have malabsorption disorders. So conditions like celiac disease or Crohn's disease can prevent the proper absorption of calcium, leading to the development of a hypocalcemia. So now let's talk about abnormally high calcium ranges. So abnormally high calcium levels in the blood is known as hypercalcemia and occurs when the calcium levels in the blood exceed 10.2 milligrams per deciliter. So causes of hypercalcemia include number 1, hyperparathyroidism. So overactivity of the parathyroid glands, which increases the release of calcium from the bones into the bloodstream, will cause hypercalcemia. At number 2, we have certain cancers. So some cancers, especially those affecting the bones, like multiple myeloma, or producing substances similar to the parathyroid hormone, such as in lung or kidney cancers, can raise the calcium levels in the blood. Number 3 is excessive vitamin D. So too much vitamin D can increase the calcium absorption from the gut, leading to higher than normal ranges. At number 4, we have prolonged immobility. So inactivity can cause the bones to release more calcium into the bloodstream than needed, causing a hypercalcemia to develop. At number 5, we have the use of thiazide diuretics. So some medications used to treat high blood pressure can reduce the calcium excretion through the kidneys, leading to higher levels in the blood. At number 6, we have sarcoidosis or tuberculosis. So these are two conditions that can increase the vitamin D production, causing elevated blood calcium levels to develop. And finally, at number 7, we have kidney failure. So in some cases, the reduced ability of the kidneys to excrete calcium can lead to higher than usual levels developing in the blood. So as we have just seen, the calcium blood test is a vital diagnostic tool that helps to monitor and manage a wide range of health conditions. It provides valuable insights into bone health, parathyroid function, kidney and heart health, vitamin D status, and more, enabling effective treatment and prevention strategies. And that brings us to the end of this video. So thank you guys so much for watching. I hope you found the presentation very interesting and informative. Please make sure to like, comment, subscribe, and share this video with anyone you think may find this video helpful. So if you want to encourage me to do even more, or to say thanks for all the free information you've received on my channel today, you can say thank you by buying me a coffee. So the link to buy me a coffee can be found in the description box below. Take care and have an awesome day further. Bye for now.